I am Dr. Naeem Hasanfatta, Consultant Interventional Cardiologist at Wockhardt Hospital, South Mumbai, and I am glad to address you on the occasion of World Heart Day. I would like to inform everyone that we at Wockhardt Hospital, we are providing comprehensive cardiac care to all the patients who are coming from all walks of life. We are currently facing a very dangerous COVID epidemic, and along with that, there have been a lot of cardiac complications which have been going around, and a lot of people have been suffering because of cardiac complications during COVID times. Even post-COVID, lot of patients are now presenting to us with acute coronary syndromes and many other cardiac complications. In fact, all over India, all hospitals have noticed an uptick in the cardiac complications in patients who are not supposed to have cardiac complication, including very young patients also. Just about last week of the last month, we had a series of complicated cardiac cases and heart attacks which presented to us day in and day out during even in the middle of the night. One case which became very close to me was a young man about 28 years of age, and he had a sudden heart attack, and he presented to me at night around 1 o'clock, and we took him up for a primary angioplasty at 2 o'clock at night, in the middle of the night, with all the family support, and services at Wockhardt Hospital were absolutely up to the mark, and the patient has had a very good result, and he is very happy and discharged very successfully back home. Today the patient's family is happy to have come to Wockhardt Hospital even during the middle of the night, and to have got such service in the middle of the night, which was life-saving for the patients. I would like to share with you some data which is coming from the Indian Heart Association also, is that India already faces a massive burden of coronary artery disease and heart disease. We have only about 20% of the world's population, but still we have the burden of more than 50 to 60% of the heart disease in the world. And in our country, heart disease strikes nearly 33% earlier as compared to the foreign countries. In our country, 50% of the heart attack cases actually happen in age less than 50 years, and 25%, that is 1/4 of all cases, are actually age less than 40 years. And this is a debilitating and highly dangerous disease, and it can lead to sudden loss of life. In fact, the data says that if patients are not treated properly, then heart attacks can have up to 30% mortality rate. Even when the treatment is provided, the mortality rate is up to 5 to 8%. So we expect everyone to, on this World Heart Day, to raise awareness and recognize that heart disease is the #1 killer disease in our country, and if there is any suspicion of anyone having a complication with a cardiac issue, then they should definitely approach their doctor as soon as possible. I would like to raise the awareness regarding a very healthy lifestyle also, because that is something that we Indians are neglecting on a large scale. We are consuming junk foods or foods that are prepared in non-edible oils or palm oils, which have been shown to have a very high content of saturated fat. Nowadays, the ready-made foods that are available or those prepared in restaurants also have a mixing of palm oil, and it is having a very deleterious effect on our body. The pollution in our environment is deleterious for the heart, and it is we are already facing an epidemic of hypertension, diabetes, obesity, cholesterol problems, dyslipidemia, and smoking. Up to quarter of our population continues to smoke or consume tobacco in some form or the other. These are all major risk factors, and they have to be controlled, and awareness has to be raised in our society that all these things are brought under control. Only then we will get a grip on cardiac disease.